Welcome to the OCO webinar series. Today's webinar topic explores the impact of social distancing on social connection in our caregiving journey. Social distancing, while necessary during the COVID-19 pandemic, creates challenges for caregivers to connect with their loved ones amid an unprecedented time of global health and economic crisis. Today, we will learn how to optimize social connection with loved ones and get the emotional support that you need and deserve now as a caregiver. I am Indira Fernando, and I will be moderating this webinar today. I'm a program lead here at the Ontario Caregiver Organization. I'm pleased to introduce today's speaker, Dr. Nasreen Khatri. Dr. Nasreen Khatri is a registered clinical psychologist, gerontologist, neuroscientist, and educator with over 15 years of professional experience. She completed her clinical internship and CIHR-funded postdoctorate at the Center for Addiction and Mental Health. From 2004 to 2012, she led the Mood and Related Disorders Clinic and founded the Cognitive Behaviour Therapy service at Baycrest Health Sciences. Since 2012, at the Rotman Research Institute, she has studied the neural link between midlife depression and the development of dementia. She innovates treatments for depression and anxiety for older adults, including CBT, mindfulness, and exercise. Dr. Khatri's research has been funded continuously since 2006 and has been published in peer-reviewed academic journals and book chapters. Dr. Khatri, thank you for joining us today.
So much, Indira and the OCO and everyone joining us at, I guess, just noon, so I'll say this afternoon. Thank you so much for having me. My focus in terms of my clinical work and research is really looking more at mood disorders and as we age and how they impact the brain. So my first few minutes where we're talking is going to be focused a little bit more on older adults as caregivers and also caregivers of people with dementia. But that's not to say that everyone who's joining us today is necessarily a caregiver of somebody who has that problem. It may be somebody who has a mental health problem, physical challenge, or something else. So I look forward to your questions and a conversation. As Indira pointed out, I'm going to be leaving quite a lot of time for that. I am going to be giving some basic information about caregiving and the impact of the COVID-19 pandemic on caregiving, and also the self-isolation that we're experiencing now. But I'm open to talking to about anything else that is on your mind. So in terms of caregiving, I think we all know the facts. I'm sure that the group the team that's meeting today knows a lot more about it firsthand than I do. Essentially, we need to really put a spotlight on caregivers because we know that millions of caregivers all across Canada are the main kind of caregiver that exists for people who have, for example, dementia. So I'll just stick to that example for the next few minutes just so we can focus on one thing. And we also know that we're actually giving billions of dollars of unpaid care to these individuals, loved ones, family members, and friends. So it's really, really important to shine a light on them and to make sure that they're getting the help that they need. We know that in 2008, there was one new dementia case every 5 minutes. And by 2038, it's going to be one new dementia case every 2 minutes. So we know that it's not the public health care system in Canada that is actually providing this care, because 90% of care is actually informal. And again, most of it is done by women. I'm going to return to that kind of gender point later on, but I just want to say and jump right ahead to the impact that caregiving has on mental health. So we know that 80% of caregivers experience depression at some point, and I'm going to break that down for you in terms of what depression and anxiety are from a clinical perspective. But before we get to that, I want to say that people obviously experience caregiving as being very, very rewarding in some ways, but there's a limit in terms of the resources we have financially in terms of our emotional resources and time. So a lot of caregivers are kind of in a situation that we often call the sandwich generation. So let's take the stereotypical caregiver who is statistically a woman who's about 49 years old, who is probably taking care of children who haven't launched yet, because children tend to launch later, and is taking care of older parents because we live longer, and is also working. And so what happens in a situation like that is people are obviously very tight for time, and that's stressful. They are also having financial difficulties because they may have to cut down on work, and they may also be just physically exhausted. We also know that caregiving is actually, as rewarding as it may be in giving us meaning, it may actually be depressogenic. So whether you're caregiving for children or for healthy children, or caregiving for older adults who are healthy, or if they have challenges that you're helping them with, it actually leads to depression more often than not being a caregiver of one kind or another. And again, women are more likely to be caregivers. But let me kind of connect the dots there. So women are more likely to be caregivers. They're also diagnosed with depression twice as often as men are. Okay, and they're also twice as likely to be diagnosed with dementia as men are. But the real kind of key to all of this, and this is what I study and work on, is that for people, men or women, who have an untreated history of depression in midlife or later, they're twice as likely to develop dementia later in life than people who don't share that untreated history. So it's really important for people to get that checkup from the neck up and make sure they access treatment for depression and anxiety in midlife, because they're really saving their mental health. And secondly, they're saving their brain health later in life. So what happens is that when we don't do that, we are actually setting ourselves up for a problem that caregivers are more likely to have. So women are more likely to be depressed, caregivers are more likely to be depressed, and women are more likely to be caregivers. And then if they do become depressed later in life, if they develop dementia, it's going to be a difficult situation for them, because it's hard to know who the caregiver will be for that person as they age, especially for people who don't have children or don't have family or don't have a partner at that time. Because statistically, women tend to have partners who are older than they are. So all of those things it's a lot to unpack, but we will talk more about that during the Q&A, and I'm happy to answer questions. So now on top of this, we layer the pandemic. And no doubt, this is a very difficult time for all of us. So I just want to kind of pause and acknowledge that everybody is experiencing distress in their own way. So whether people are more anxious, more down, more angry, more frustrated, lonelier, all of those things are natural reactions. It's hard to know who wouldn't feel that way during a time like this, but it's an added burden for people who are caregivers who aren't able to do, as I said earlier, most of caregiving is informal. So you may be caregiving in a sense for example, your father who is living independently and is healthy, but you're just checking in, buying groceries, visiting. And so it's not so much that people are necessarily caregivers of somebody who's ill or unwell, but that they're not able to keep that connection, both for their own sake, peace of mind, and because of the love and relationship they have with that person, but also because of the fact that they're not able to help them. So remember earlier I said that it's kind of a sandwich generation for the stereotypical middle-aged caregiving woman. Obviously there's people of all ages who are caregiving, but we'll just kind of stick with that example. I really see this caregiving picture less as a sandwich and more as a pizza, meaning that there are hierarchical relationships like parents, like children, but there's also many, many lateral relationships because of the way that society is now, meaning that people marry later, have children later, or don't have children at all. They may be caregiving for friends, neighbors, spouses, ex-spouses, and it kind of just spreads out into the, horizon. And so there's a lot of different kinds of relationships that people may be experiencing as caregiving relationships. And so we have to be careful about self-care, which is selfless. We need to take care of ourselves for the very fact that we are the ones who are supporting other people through our relationships. And I say we because essentially there's only three kinds of people in this world: people who were caregivers, people who are caregivers now, and people who will become caregivers in the future. So I think that it's really, really important, as I said, to kind of shine a light. What I'm going to talk about next is sort of something hopeful, which is research that we've been doing with caregivers for caregivers, and talking a little bit about the pivot to working online with some of those programs so that we can reach caregivers where they live, essentially. And then talking about what caregivers need to be aware of in terms of their own mental health and when they should seek help. And then I'll end off with some tips, hopefully helpful, and then we'll open it up for Q&A. So the kind of studies that I do that help caregivers, or hopefully do, my team and I were the first at Baycrest, at the Rotman Research Institute, to find that cognitive behavior therapy, which is the gold standard treatment for depression now, and it's essentially evidence-based talk therapy that can be rolled out in a group or individually, and it focuses on turning maladaptive patterns of thinking into adaptive patterns, which helps mood and helps functioning. And so we were the first to actually establish a group cognitive behavior therapy program specifically for caregivers, spousal caregivers of individuals with dementia who were not in long-term care, who were actually community dwelling. And what we found is that at the beginning of the study, 100% of the participants met criteria for depression or anxiety. And then at the end of the study, 3 out of 10 met criteria. So we were successful in improving their mood. And as I said earlier, saving your mental health helps you to save your brain health later, because they were not in that group of having untreated depression or anxiety in midlife. I just want to open that up a bit and say the reason that's important is because we have, depression and anxiety are eminently treatable. We have excellent medication and non-medication treatments for depression and anxiety, but currently dementia is incurable. So we never want to see, as clinicians and researchers and scientists, see anyone go down that cognitive path or being untreated for depression and anxiety and then developing dementia later. So we found that people, long story short, we found out that people really improved with this evidence-based cognitive behavior therapy treatment for caregivers. But the other thing we found is that not only were they thinking more adaptively and improving their mood, they were thinking more clearly. So on neuropsychological profiles, just meaning paper and pencil tests of cognition, so thinking, concentrating, attention, planning, it improved. So it really is a bit of a silver bullet for older adults with depression and anxiety, whether they're caregivers or not, because it helps individuals to improve their mood and not be in a clinical state of depression or anxiety. And then secondly, it improves their ability to think, it improves their cognition. So that's important to see. Another program that I collaborated with the Canadian Mental Health Association was called Living Life to the Full. And in that, it was actually that I trained non-clinicians to do this group work with people in senior centers. So we kind of just, reached them where they lived. And the purpose of it was not really to treat people who are clinically unwell, but just wanted some help in terms of their stress management. So it was a problem-solving group. So it was peer-run. It was run in 4 languages: English, French, Mandarin, and Cantonese, all across Southern Ontario. And we had hundreds of participants, and we found the same thing, so that these peers who were given some training in the principles of cognitive behavior therapy, or CBT, so again, this evidence-based problem-solving talk therapy, we found the same results with individuals, that they really improved. So it shows that we can optimize our brain health and our mental health. Even if we are not unwell, it doesn't mean that we can't improve. So I'm going to kind of stop there with talking about research and move now and talk a little bit about caregiving. So because we're in a very unprecedented situation, we're really in, a multitude or multiple pandemics at once. The first is the physical health pandemic of people developing coronavirus and having those symptoms and becoming ill with that. The second is an economic pandemic, which is really causing mass unemployment and really wreaking havoc with the world economy. And as I said, caregivers are vulnerable to not being able to work full-time or having to change hours to accommodate their caregiving role anyway. And that is exacerbated in a time where there's economic changes and problems, health problems, and as well, because we know that our elders are more vulnerable they're in a vulnerable group all on their own to be developing coronavirus. And the third one is kind of the emotional or the mental health fallout from all of this. So let me just kind of take you through that. If you are a caregiver, or if you're working with caregivers, and you're finding that either your clients or yourself are feeling anxious, angry, hopeless, feeling grief, that's all natural, because some of the psychological effects of quarantine are sort of PTSD-like symptoms, so post-traumatic stress disorder, where you're starting to feel like you're experiencing a lot of stress and almost like it's traumatic. In this case, one thing you can say is that you're not alone. So think of me and think of this talk and our conversation today. This is what we are all going through. And I hope that webinars like this and the ability to connect, I wish we were all together in the same room, but nonetheless, connecting over this and sharing is a way to kind of open that up. So to know that caregivers are not alone, caregivers often say that to me and to others, that they feel isolated at the best of times. And in this situation where we're self-isolated, we need to really learn to acknowledge that, to honor that, and know that it's natural. There's nothing unusual about that. So I'm going to pick one specific example that probably a lot of people can relate to. One thing that people have been telling me more and more during the pandemic is that they have trouble sleeping, even more than before, let's say as a caregiver. But there's good reason for that. One of the impacts of quarantine is feeling like we're under siege. So 1/3 of us actually live alone now in Canada. So it's actually the most popular household setup is for people to live alone. So they may be experiencing that their isolation in a more magnified way, because they may feel lonelier and not be able to go out to have their social experiences in the same way they did before. But whether people are living alone or with their own families, or partners or roommates or what have you, or the person that they're caregiving for, when you are when you have to self-isolate and it's not a choice that you can leave the people that you're with, people start to feel psychologically under siege, because we're very socially connected as human beings. And so I think that if there's something that the pandemic is teaching us, it's that we are more social than we realized. So people who live alone may feel this even more, but even people who are living with others may feel that they can't connect to someone that they're informally caregiving for, to friends and family, just all the natural connections we have, to workmates. And so what that makes us feel like is that we're being separated from the group. And that's very stressful for human beings and all mammals. So what starts to happen physiologically is our stress hormone goes up. our cortisol goes up, and our testosterone, which is the mastery hormone, goes down. So both men and women have testosterone. So that goes down, and cortisol, the stress hormone, goes up. And when it goes up and it stays up, it starts to kill brain cells. And it's more likely to lead to things like depression and anxiety. So what's that got to do with sleep? So what ends up happening from a kind of a more primal or evolutionary perspective is if you were alone, you weren't safe. Now we are safe where we are, by and large, but you can't argue with, the more primal part of the brain or the physiology, because it hits you at a really visceral physical level. So it's the problem of sort of sleeping with one eye open, because we don't feel the normal amount of connection that we do to people that we know and love. So when sleep is disrupted, it also disrupts other body systems and is making us more likely to be stressed and not be able to sort of think straight during the daytime. So that's kind of one example of something that may be disrupted. But let's kind of open it up and talk about the idea of, well, what's normal? We talk about what is normal right now, what used to be normal, what's going to be the new normal, both in terms of society, but also in terms of feelings and emotions and mental health. But let's break that down. All mental disorders are just two things. It's that you feel distressed, either you feel too lonely, too angry, too sad, too anxious, too much feeling a sense of loss or hopelessness a lot of the time. So it's emotional. Then the other part of it is that your functioning is disrupted in two or more areas of life. So your work relationships, your ability to work, your ability to do chores or daily activities in the home, your relationships. So those are the two things. The other thing I want to mention is that mental health is a continuum. It's not a switch. All of us are at times much more well than we are at other times, or much less stressed or much more stressed. But right now, we need to really be aware that it's natural for us to be more stressed, to acknowledge it, to accept it to some extent, and then do what we can to adapt. So I think when I'm asked about, well, what's normal now, or what is it going to be, I think we need to kind of put that word on the shelf for a while and not worry about what's normal, but what's adaptive and what's going to be healthy. So let me give you an example. Let's look at the two examples that are two mental disorders that make up most of mental health problems, like 70 to 80% in the non-hospitalized community. So community dwelling people, it's depression and anxiety. So let's talk about it from a clinical perspective. So what is depression? When you go to the doctor or you see a mental health professional, what are they looking for? So clinical depression is really, a constellation of three baskets of symptoms. So by that, I mean, the first basket is the stereotypical I feel depressed. So feeling, low, sad, numb, not being able to feel, those kinds of things. And then the second basket of symptoms is physical. So changes in sleep, feeling that you can't sleep or have insomnia, or feeling you have to sleep all the time. Physical in terms of your appetite. So feeling that you really want to eat a lot of comfort food or you can't eat. And then last is energy. So you may feel like you have no energy at all, or you may feel that you're kind of driven by a motor, so agitated. You can't sit still, but not in a pleasant way. And then the third basket is cognitive. So whether you're a child, an adolescent, an adult, an older adult, everybody has cognitive problems when they have depression, meaning anything from suicidal thoughts to very negative thinking, and then also disruptions in the ability to think. So problem with reasoning, attention, concentration, planning, and even social skills. So essentially, if someone is having, all or some of those symptoms, so the basket of emotional symptoms, the basket of physical changes, and the basket of cognitive problems, for 2, 3, 4 weeks or more, and it's not changing, that's the time to see your doctor or mental health professional and get that checkup from the neck up and find out what's going on. Why? Because we, I, as a researcher and a clinician working with older adults and as a scientist, we care. It's important that caregivers take care of themselves, not just so that they can be better caregivers, but because we deserve it. All human beings deserve to have good mental health. And we find in studies that caregivers are often reluctant to seek help because they're tight for time, because they feel that guilty taking time away from their other duties. But again, self-care is selfless. So caregivers need to shine that light on themselves, a caregiving light, and do something for themselves. And I'll talk about what those things are in a minute. Let me also talk about clinical anxiety. So what's the difference between, just being anxious because of a global pandemic and just, being more than that, being clinically anxious? So the best kind of specific example I can give is, let's say that a door shuts behind me super loudly. I'm going to startle, and even some of you who are online may startle. But the difference between my experience of startle and someone who's clinically anxious is that when I startle, I might have some anxious thoughts, my heart will race, my blood pressure will go up, but within a couple of minutes, and for sure by around 5 or 10 minutes, my heart rate, my blood pressure will all go back to my own usual baseline. But with clinically anxious individuals, it doesn't. So think of a pot of water that's already 50% boiling. It doesn't take much heat or much stress to have it boiling over. And even when you turn it off, it's going to take a long time for that water to come back down to room temperature. So essentially, that load is always there. The load of anxiety, the load of depression, the load of low mood, thinking problems, all of those kinds of things. So I hope that kind of clarifies things a little bit as to when to seek help or what to be concerned about. Let me also kind of turn to now what the tips are. Essentially, let's talk about where we started and where we are now. We talked about a little bit about the statistics of caregiving right now in Canada, why it's important to shine a light on caregivers, and what kind of light would be helpful. So what kind of research have we been doing where we found that we actually are able to improve the mood and the thinking of individuals who are caregivers? And we talked a bit about the backdrop, so the kind of societal situation of the caregiving sort of sandwich generation or pizza generation, and the overlay of pandemics, both financial and health, because we often care for people who are in a vulnerable group for coronavirus. And then I think we need to kind of bring this all into the good news. So what will we do about it? What will we do about being in this situation? So there's lots that we can do. And I hope that some of this is helpful. Everybody finds different things helpful. The first one is kind of what we're doing today. I'm hoping we are, because I'm lending more time to the conversation part of today's event, which is to talk to someone. Whether you're talking to me now or talking to someone else because of what we kind of unpacked today, it's important. Studies show that talking to someone who's a confidant, a friend, a family member, a counselor, somebody in spiritual services, somebody who you trust as a mental health or a medical professional. I mean, it doesn't have to be a professional, but you need to really unload what you're thinking. Why? Because it lets out the emotion. It helps our physiology, our cortisol levels go down, our stress hormones go down. But the other part of it is we get some support, the support we need and deserve. We also get some perspective. Once you get it out, you can kind of hear yourself say it, hear yourself say your problems, and they don't seem as terrible anymore, because you're not sort of feeling like you're holding a beach ball underwater. And it also gives you a chance not only to be emotionally supportive, but the person you're talking to may actually give you instrumental help. They may have somebody you can call to follow up on your difficulties. They may problem solve with you. They may give you financial help. They may give you caregiving help. So being open about our needs is important because, you know, no one can read our minds. People don't know what we're holding in or what we need or want. The second thing is, maybe the first thing actually, is just to know that you're not alone. Absolutely everybody has been humbled and impacted and distressed by the pandemic we're in. And as I said earlier, if there's one lesson we can take away, it's that we're all connected. I can bet that going forward, at least for the foreseeable future, people are more sensitized to other people's difficulties pre-pandemic and also difficulties they're having now. So in fact, people are probably going to be a little more sensitive to what you have to say and to sharing. A proven way to help your mood and help your thinking is to write a journal. And here you don't need to write a novel about your experience in coronavirus. You know, anything you can write down, something about what the problem is today, a list of things that you want to get to, some thoughts you're having. It can just be sort of a point form, jotting things down. It's still important because, as we know from other models like business and things, what gets measured gets managed. But even if you just write it down, it starts to feel better. I talked a little bit about sleep in terms of how it gets disrupted when we are in self-isolation. But remember, sleep, exercise, and diet, you know, it's something you hear always from health professionals, but it's ever so important now. So we need to get a sense of control right now when we feel that a lot of things are not in our control. How do we do that? By putting structure on a situation that can easily become very sort of fluid. And so we want to get up at the same time. We want to make sure that we, you know, have a shower and change our clothes, take our meals at the same times as we were before, have some at least small goals for the day. So it's not, I mean, I know that I'm kind of speaking to people who are very busy, so I know it's not leisure land, so it's not as though you don't have things to do. But I think it's important to still focus on those things, keep them structured and as healthy as you can. So I'm going to say one tip about each thing. When it comes to sleep, it's really, really key. So please try to sleep at the same time every night, get up at the same time. If you have difficulty sleeping, just write down the things you're thinking about and just put them away. So these are things that studies show can help you have better sleep. When it comes to exercise, if you're able to go outside and whatever you can do with safe self-distancing, even stretching, yoga, walking around your home, walking around your yard, or walking down the street, whatever you can do safely is important, because it's really important for mental health and brain health to be able to exercise a little bit each day. And in terms of diet, my tip is always, when it's snack time, choose something with only one ingredient. Like a banana only has bananas in it, you know, potatoes just have potatoes. And so it's a simple thing, but it's something I use, and it helps me to stay on track and eat something healthy. I think the other thing that is shown by research to work is practicing gratitude. So we are all in a tough situation, some of us in much tougher than others, no doubt. But I think it's a time where we can either write down or think about once a day something that we're grateful for. And research shows that helps people in their mental health, and it helps in their ability to plan and think and do things that are actually, you know, kind of smarter in terms of planning and functioning. And another thing that's important to do is to rest. So we don't have a lot of respect for wakeful resting in sort of Western societies, but it is important to be able to just listen to music, you know, meditate, do some yoga, listen to positive affirmations, listening to whatever works for you. You know, it could be anything at all. So people who take even 5 minutes out to rest while they're awake are doing themselves a lot of good. Also, trying to do something you enjoy. One of the main things I hear from anyone, from friends and family, from people I work with, to clients, to absolutely everyone, is, you know, they feel that the very things that would comfort them now are taken away from them somehow. So, you know, everything from sports to entertainment, to going out, to cafes, bars, restaurants, so many things. And in a way, I think that what we're all experiencing as a group is a kind of anticipatory grief, which means that you feel a loss of something you haven't even had yet. So, for example, for younger people, it can be milestones like graduations, whatever they were, you know, looking forward to, summer jobs. But all of us have lost something. And I think that we share that kind of grief of the kind of life we were leading and the things that we were looking forward to. But human beings are very adaptive. So I think it's important to find something you do enjoy, whether it's a funny show, a piece of music, food that you like to cook or buy, just any small thing that you can look forward to. And I think finally, especially important for caregivers, is to make a plan. So writing down some notes about who else could be helping you, or what's the plan. I made that very sort of basic example at the beginning, that you're you know, popping in on your father or something like that. I mean, that's kind of caregiving light, but nonetheless, you know what I mean, that, you know, who else could be helping you with that? How else can you meet? Writing letters, texting, FaceTiming, sending food, you know, writing cards, whatever you can do, whatever the style of your family, friends, and social network is in terms of communicating. It's really important to have that social connection now. And I think the final thing I want to say is that I think I have a lot of hope, and I want that to come across. You know, I've been called an optimist, but I think an optimist does something because they think it's going to turn out well. I think the way I feel during this pandemic isn't necessarily optimism, but hope, because hope is doing something because you think it's worthwhile no matter how it turns out. So I wish everybody to stay well and stay safe. And I think I'll just turn it over to Indira now so that we can meet all of you and get to your questions.
Dr. Khatri, thank you so much for such an inspiring talk.